Here's a scenario that should concern anyone who works in health or knows someone who uses recreational substances. You think you're taking one drug, but you're actually getting something completely different and potentially far more dangerous. This isn't theoretical. It's happening right now in Melbourne, and it's the kind of situation that can turn a night out into a medical emergency. A drug notification just came across my desk, and I want to talk about it because this is exactly the kind of harm reduction information that saves lives. So here's what's happening. A substance called Tiletamine is being sold on the street as 4-MMC or MCAT. That's Mephedrone for those who know the chemical name. Now, if you're not familiar with these substances, let me give you the critical context. Mephedrone is a stimulant. Think somewhere between MDMA ecstasy and cocaine in terms of effects. People who take it are expecting euphoria, increased energy, maybe 2 to 3 hours of stimulation, and enhanced sociability. It's what they're paying for, it's what they're expecting to manage. But tiletamine, that's a completely different beast, and this particular mismatch is especially concerning. Tiletamine is actually a veterinary anesthetic. It's a ketamine analog that we use to sedate animals for surgery. And here's the critical difference. It's much more potent than ketamine and significantly longer lasting. We're talking effects that can persist for 4 to 6 hours. Think about that for a moment. You're expecting a stimulant rush for a couple of hours. Instead, you're getting an anesthetic that can cause loss of coordination, loss of motor control, or even loss of consciousness. At higher doses, and remember, people dosing for a stimulant might take amounts that are dangerous for an anesthetic, this can be genuinely life-threatening. Now, there's a second substance mentioned in this notification, N-benzylcyclohexenamine. This is even more concerning in some ways because we know less about it. It is typically used as a synthetic ingredient in chemistry, a building block for making other compounds. Sometimes it's used as a cutting agent to bulk up drugs. The problem? Its psychoactivity and risks are largely unknown. When you're talking about unknown substances, you're essentially playing pharmacological Russian roulette. We don't know how it interacts with other drugs, what dose is dangerous, or what the long-term side effects might be. Here's what this means from a clinical and public health perspective. In my practice, I've treated countless patients whose addiction journeys started with what they thought was one thing and turned out to be another. The unpredictability of the illicit drug market is one of its most dangerous features. When you combine stimulant-seeking behavior with a substance that has a sedative and anesthetic property, you get a perfect storm for adverse outcomes: respiratory depression, accidents due to impaired coordination, inability to recognize when you're in medical danger. And this isn't just about individual choice. This is about a contaminated drug supply. Even people who are trying to minimize their risks, testing their drugs, starting with small amounts, can be caught off guard when the substance is fundamentally misrepresented. So here's what this means for you. Whether you're a healthcare provider, someone who uses substances, or someone who cares about harm reduction. First, if you're in Melbourne or Victoria, know that there is now a drug checking service available. The Victorian Pill Testing Service has a fixed site in Fitzroy on Brunswick Street. It's free, it's confidential, and it's legal. If you're going to use substances, this is how you get actual information about what you're taking. Second, for healthcare providers, be aware that your patients who report using stimulants might actually be experiencing anesthetic effects. That changes your clinical assessment significantly. Ask specific questions about the effects they experienced, not just what they thought they took. And third, these kinds of drug notifications remind us that prohibition doesn't create purity, it creates unpredictability. The safest approach is always not using substances at all. But if people are going to use, they deserve accurate information and access to harm reduction services. The bottom line is this: what you think you're getting and what you're actually getting can be dangerously different. In this case, people seeking a stimulant are getting a veterinary anesthetic mixed with unknown compounds. That's not a small mismatch, it's potentially a lethal one. If this notification is relevant to you or someone you know, take it seriously. Use drug checking services if they're available. Start low, go slow, and never use alone. And remember, there's no shame in asking for help. Health professionals like me, we're not here to judge, we're here to keep people alive and healthy. I'm Dr. Fergal Armstrong. Stay safe out there.